So for the investigations, we are going to use now the SHRV algorithm. So we start by investigating the disease. We have also the investigating a differential diagnosis that you have to speak about. Is it clear? That I've forgotten to tell you. Now, the differential diagnosis of sickle cell that we're going to speak about it here, differential diagnosis of sickle cell. For the differential diagnosis of sickle cell, we need to know that what generally the differential diagnosis of sickle cell are taken as the differentials of hemolysis. Basically, the differentials of hemolysis, and hemolysis is seen when you speak about hemolysis when you have a full blood count, where you have a normocytic normochromic anemia. Is it clear? So when you have a full blood count, you receive a full blood count, you have normocytic normochromic anemia. You speak about two things. You speak about hemorrhage. Is it clear? You speak about hemorrhage and you speak about hemolysis. Is it clear? So those are the two major elements you have to speak about when you have a patient that has normocytic normochromic anemia. Is it clear? Now, since you have in sickle cell, there is usually associated with chronic hemolysis, I'm going just to speak about hemolysis. Now, you have a broad array of differentials under hemolysis. If you don't think of sickle cell, you can think again of what? Is it clear? So when you have elements of hemolysis, now you need to know that first, on physical examination, the elements of hemolysis are two major. You have anemia and you have jaundice. Is it clear? So if you have a patient both with anemia and jaundice, you can think of a hemolysis. Is it clear? Anemia and jaundice in a patient can make you think of a hemolysis. Now, the next one is you need to know that what hemolysis is divided into two. You have intravascular hemolysis. You have intravascular hemolysis and you have extravascular hemolysis. Intravascular hemolysis and extravascular hemolysis. Is it clear? Now, generally, all of them is going to have anemia and jaundice, but the peculiarity in that, in the case of extravascular hemolysis, is that we have a splenomegaly, and we have a case we can have hepatomegaly. And this is the case, this is the reason why in malaria, children can have splenomegaly. Is it clear? That splenomegaly is just to show you that there is an extravascular hemolysis. Is it clear? And hepatomegaly, that hepatomegaly is to show you that there is an extravascular hemolysis. So if you have a patient that has anemia plus jaundice plus spleno and hepatomegaly, you can think of extravascular hemolysis particularly. But if you have just intravascular hemolysis, it's just going to be anemia and jaundice. Is it clear? So that is how you can say on your clinical summary. Is it clear? You can speak of extravascular hemolysis, intravascular hemolysis by visualizing all these terms. Now, what are the differentials now of hemolysis? When you want to speak about differential of hemolysis, you have to divide your differential with respect to the first element is the blood vessel. You have first the blood vessel. Is it clear? You have the blood vessel. Then the second element is the blood. The first element is the blood vessels you have to speak about. Then you have to speak about the blood. Is it clear? Then we have the differentials of hemolysis of the red blood cells. Now, the differential hemolysis of the red blood cell is divided into the differentials for the first one, which is the cell membrane. Is it clear? Differentials of hemolysis on the cell membrane. You have the differential of hemolysis of the second one now, which is the enzymes. Differential of hemolysis, second one, which is the enzymes. And we have differentials of the hemolysis for the next one now, which is hemoglobin. Is it clear? Hemoglobin. So those are the different, this is how you have to evaluate for the differential of hemolysis. Now, for the differentials of hemolysis, we start with the first one, with the blood vessels. Is it clear? With the blood vessels. So with the blood vessels, what are the things that can result to hemolysis? The first one, you have a case of intravascular hemolysis from a microangiopathy. Basically, when you have microangiopathy, and that microangiopathy can occur in a case of thrombotic microangiopathy in malignant hypertension. Is it clear? Thrombotic microangiopathy when you have malignant hypertension. Is it clear? Thrombotic microangiopathy when you have malignant hypertension. So when you have malignant hypertension, I've already explained this mechanism severally. Is it clear? If you want to understand it best, you want to see the tutorial on preeclampsia. The next one after that, so for the blood vessels, so generally it is microangiopathy that can result to destruction of blood vessels, is it clear? Which can result to hemolysis. Now the next one after that, after the blood vessel, we have the blood. So in the blood, what are the elements that can result to hemolysis? In the blood, you need to know that what you have the white blood cells, is it clear? In the white blood cells can result to hemolysis. How? By the production of the antibodies. So we have what is called autoimmune hemolysis. Is it clear? You have autoimmune hemolysis due to the production of the IgG and the IgM, which are against the antibiotics. So we have autoimmune hemolysis due to the production of IgG and IgM, which are against the red blood cells of the body. Is it clear? Now the next one is in the blood again. What is it? What can we have? Is it clear? In the blood, we can have the blood plasma. In the blood plasma, what are the pathogenic or what are the pathogenic elements that can occur in the blood plasma? In the blood plasma, the first element we can have as pathogenic element, you can have the first one, which is bacteria. Is it clear? Bacteria. So bacteria in the case of the blood can still result to hemolysis, particularly when you have sepsis. Is it clear? Or septicemia. Is it clear? Septicemia can result to an event where you have hemolysis. I've already explained you that bacteria contains CD04, so it can result to iron deficiency, a fake iron deficiency anemia because of the storage of the iron in the body, or bacteria can still result to anemia by hemolysis. So there are two major mechanisms via which bacteria result to anemia. It can either be via hemolysis, in this case that we are speaking about, where we have extravascular hemolysis, destruction of the bacteria and the red blood cells in the spleen, or it can still occur via iron deficiency anemia, a fake iron deficiency anemia, because bacteria contains CD04 that are going to use the iron, so the body store the iron and reduce the iron in blood. Is it clear? So that is for the bacteria. The next one element, you can have toxins. Is it clear? There are certain toxins that causes hemolysis, particularly the sugar toxin, and this sugar toxin is produced by Escherichia coli enterohemolyticus or enterotoxicogenic, and we have also Shigella bacteria. Is it clear? Shigella bacteria. Is it clear? So those are the two major organisms that produces the sugar toxin, and this sugar toxin causes what is called the hemolytic uremic syndrome. Hemolytic uremic syndrome. From the element hemolytic, you already understand that there is a hemolysis. So hemolytic uremic syndrome. Still from the blood plasma. Still in the blood plasma now, we have protozoans that can result to hemolysis. The first protozoan resulting to hemolysis, we have malaria. Is it clear? It can result to intravascular hemolysis, extravascular hemolysis, and you have leishmaniasis. Leishmaniasis. Is it clear? So other element, we have leptospirosis. Is it clear? So which can result to hemolysis. Is it clear? Still in the blood plasma. So that is for the blood. All the differentials, these are how you should bring out all your differentials of hemolysis that when you have it. Now the next element, after the blood, which can result to hemolysis, we now have the red blood cells. Is it clear? We have the red blood cells here. We have the cell membrane of the red blood cells. So in the cell membrane of the red blood cell, we have the etiology of hemolysis is any abnormality of the cell membrane, like the case of hereditary spherocytosis. Is it clear? Spherocytosis. That hereditary spherocytosis can result to cell membrane abnormality. It's another cause of hemolysis. Is it hereditary spherocytosis? And we have other abnormality of the shape. Is it clear? That you have to note. Now abnormalities of the enzymes which can result to hemolysis. Is it clear? Abnormality of the enzyme that can result to hemolysis. You need to know that what the enzymes you have in the case of a G6PD deficiency. Is it clear? G6PD deficiency particularly occurring in male children and has a precipitating factors which actually with certain drugs. Is it clear? You have G6PD deficiency that occur, and you have also children apart from G6PD deficiency. You have also pyruvate deficiency. Pyruvate deficiency. When you have both of them, they can still result to hemolysis. Is it clear? Now, the next thing that can result to hemolysis is hemoglobin abnormality. Is it clear? Hemoglobin abnormality. And in the case of hemoglobin abnormality, you said that what in the hemoglobin abnormality we have two major ones. When we have a globin disorder, is it clear? And in the you had the heme portion, we said that we have the heme portion and we have the globin disorder. When you have globin disorder, it can be divided alpha or beta. So in alpha, we have things like alpha thalassemias, which can still result to hemolysis. In beta, you have beta thalassemias, is it clear, which can result to hemolysis, and you have sickle cell disease, which can result to hemolysis. And for the heme, is it clear, generally associated with dark urine, they can still be etiologies of hemolysis, but they are rare etiologies of hemolysis, particularly porphyrias. Is it clear? So those are the different, this is how you have to understand the differential diagnosis of hemolysis. Is it clear? After understanding the differential diagnosis, we're now going to speak about the investigations.